My first time to hear about Ebola was in Chula. I never knew if my father was having Ebola. So he went to the house, I used to take care of him, everything. So after that, my father passed away.
My mother, my two brothers, my auntie, her husband, her daughter, my sister-in-law. When I was sick, my husband was taking care of me, but he also died too. I was the only person that survived out of the 10.
Since the Ebola outbreak started, over 25,000 cases have been reported, 9,000 of which in Liberia. The disease is a painful journey in a quarantined environment. If you manage to overcome the Ebola virus, you still have to tackle stigma, financial issues, and trauma, as usually the whole family is affected. We are looking at the impact Ebola has had in Liberia and the problems it has caused.
The Ebola outbreak actually started sometime around March of 2014, and we had cases in Lofa, one of the counties bordering Guinea. The second phase started in Monrovia. And then, of course, because it's a large city and because EVD is transmitted by contact with people, thick, crowded population, so we have exponential increases in EVD in Liberia because it came to a large city. This has never happened before in the world.
My younger brother was staying with one of my older auntie. Her daughter got sick from Monrovia, came down to Kakata, and later died. And from that point, he contacted the virus. That was from the 2nd of September to the 4th of September, and he died on the 4th of September. So from that point, because I was taking care of him, feeding him, and I contacted it, 10 family members contacted the virus from my brother. We tried calling the Amode, call. Before the Amode could come, my other brother died in here. They took us to the hospital, and I was the only person that survived out of the 10.
Managing to overcome Ebola doesn't mean that your problems are over just yet. For survivors, this is usually the start of a whole new range of problems.
When you get Ebola, people are afraid of you. They're running away from you. It will not be say you get children, you do your children behind. They will suffer behind you a lot.
The population generally also have fear of health facilities and of health workers. At some time, people saw health workers in the street and were calling them Ebola. They felt that we were giving them Ebola.
Initially, about 70% of people who contract Ebola died. But over time, that has reduced to between 50 and 60%. So, in other words, there are survivors. The survivors of this epidemic are being stigmatized. For example, many of them could not go back to their regular work. Some of them, their neighbors, their neighborhoods are rejecting them. Communities are rejecting them. Even churches, they are rejecting them because they don't want to be, they assume that because they have had Ebola, they will always transmit Ebola.
There are six different health facilities that provide treatment for people with Ebola.
The aftercare psychosocial is critical because survivors cannot go on with their lives if they have not resolved all the mental health and related issues that they have encountered on their journey recovering from Ebola. They can't recover from Ebola without a psychosocial component. They need that support, they need that help.
Women especially are victimized after returning home to their communities. At dedicated one-stop centers, all support that can be given is bundled at one location.
UNFPA has been working to support what we call one-stop center. This center originally was conceived for sexual and gender-based violent survivors, people who have been raped, people who have been stigmatized due to sexual violence. So, but then because of the Ebola epidemic, we decided to expand these services.
With Ebola, We have to come in to help people process grief and loss in a way to move forward. A one-stop center is a facility placed in a medical setting where we bring our service providers that a person who has experienced domestic or sexual violence have to go to. So you have the police there, you have a legal advocate there, you have a medical person, and you have counselors. And then also we have made provision for short stay safe home. Connection of think UNFPA and the Embassy of Sweden. Sweden provides the funding to UNFPA, and UNFPA gives it to an implementing partner. And so think is an implementing partner of UNFPA.
For Sweden, it's one of the most important issues, and also that together with UNFPA, which is in the forefront of working with SGBV and GBV, for us it's a very natural partnership. Because if women cannot move around, when they go to their jobs or go to their schools or having a partner, they are closed in society. This is a high important priority for women to be able to participate in society's all aspects.
Besides psychological help, survivors receive goods to help build up their lives again.
During the Ebola war, if you use something, everybody is afraid of it, so they have to burn it. Bed sheet, cottons, toothpaste, tissue, bathing soap, washing soap, slippers, and underclothes.
UNFPA knows that when somebody is infected or affected with the disease, they usually lose everything. So then, of course, we need to replace them.
UNFPA has been handing out dignity kits, which include household items, clothes, and a mattress. These items will help survivors pick up their lives again. Not only survivors are affected, Ebola managed to bring all the countries in the region to a halt. Schools and shops were closed. Even health facilities closed their doors out of fear. Mostly health workers stayed away. So UNFPA has been spreading supplies to make clinics and hospitals safer working environments.
Because health workers had issue about self-preservation and protection, in which they were advocating for the government to provide PPEs, establish ETUs. I used to worry about, going to purchase gloves on the local market and all of that. I have probably ample supply of PPEs and gloves and all those things in my warehouse. And I think maybe for 2 months or 3 months, I'm not going to run out.
We provided GYN gloves. We have provided reproductive health kits, for example, to all the health facilities, over 600 health facilities in Liberia. And this is being used. We also provide training to the health workers so that, they get the materials, they work with the survivors and the community at large to ensure that all these materials do have an effect, an impact on the community at large.
People who come to a hospital for reasons other than Ebola can also encounter problems. They are often rejected at the entrance if they show symptoms of the disease, even if it is clear that they have another emergency.
That way I get bread, I thought the rain was falling. The rain was falling plenty here. I thought the rain was falling, that way I get breath. I went to Benson Hospital. Benson refused me. He said they can't hold me. I felt bad because the way the Ebola they used to be refusing the be better than when they on the side where they refuse the be better than. So myself when I went to the hospital, the way they refuse me, I said, but then like Ebola classes, so that the Ebola make it put and refuse me. I suffer. Was raining, I did walk underneath the rain was falling. People were underneath the rain from place to place.
The connection between Ebola and pregnant women is that reduced access to health facilities. Now on the issue of maternal health, that is an inherent, problem that we've been struggling with in the past. And MDG 5 we're targeting, and now 2015 has come, everything is quiet. And Liberia was on the path to making some progress. And then Ebola came, and the statistics are being reversed. So it is a major, major challenge. But people, the women are coming to hospital, we're giving them the care, and we're trying to encourage more people to deliver at the hospital. And we're generally positive, about that. And with international collaboration with UNFPA and other donors, we feel that we can still do the job.
Women were dying on the streets. They were not accepted in the clinics because the midwives were saying they were not protected. So they needed the gloves. So when the gloves came, it was a major relief, not only to us, but also to the women, pregnant women, but particularly to the healthcare agency. There's been about 30% decline in deliveries in health facilities. There has been about 30% decline in access to health facilities. There's a lot of work to be done. Even before the Ebola crisis came, the health system was not that great. We have been improving over time. Maternal mortality, unfortunately, is still increasing. The impact of Ebola has really made it even worse. The international community has been responding to us, but we need much more support to ensure that we can lift people out of poverty.
In the future, I want to become a nurse because the health worker, let's just say the health worker, it helped the country a lot, so I want to become a health worker.